All right, so again, you have the flexor muscles are going to be on the anterior side. And then, so here's, like I said, here's some of the deeper ones. Most of these superficial ones are going to come off of the medial epicondyle. And then as you get into the deeper ones, they're going to be a little bit more distal. And so then there's the pronator teres. So it's, again, it comes off of that common medial epicondyle, the humerus here, and it's going to come over here into the radius. So you can see it's coming across like this, so it's going to pull this way. So it's going to pronate the forearm. All right, then we're going to get into these muscles. There's a part where we talked before about how muscles have a couple different names. So there's going to be a few of them that have, the first name is going to be flexor. Okay, so that means it's going to flex the wrist. And then carpi. It doesn't actually insert into the carpals, but that's specifying that it's inserting into the wrist area as opposed to going into the fingers. Okay, so we have flexor, carpi, and then we're going to have one on this side. So what are you going to call that? What bonus is here? So flexor carpi radialis and flexor carpi ulnaris. So that's going to be these two here. So you can see that it's on the radial side, and it goes actually into the metacarpal. And then the same thing over here. So, but this is the ulnar, and then this is the radial. So flexor carpi radialis and flexor carpi ulnaris. Right, so then this flexor carpi radialis is going to originate again on that common medial epicondyle, and then it's going to go into the second and third metacarpals at the base. Remember when we talked about the metacarpals, this is the metacarpal bases and these are the metacarpal heads, as you could here. And then it's going to do wrist flexion, and then a lot of these muscles, since they do cross the elbow, they are going to flex the elbow, but they're not going to be prime movers. They're going to be accessory muscles. Their main motion is going to be to flex the wrist. Okay, so is that are these muscles going to have anything to do with the flexing the fingers? No, it's just going to be here at the wrist. And then we'll get into the palpation, but basically those are going to be, like this is going to be flexor carpi ulnaris right here. Okay, so it's on the ulnar side, and then over here on the radial side. This is the palmaris right here. And then here's the flexor carpi radialis. But we'll get into more of that when we do palpation. And so then here's the palmaris longus. Again, it's going to come off of that same common origin. And then it's coming in here into the palm. So it inserts into a palmar aponeurosis, which is fascia on the palm here. Okay. That's the one muscle that's more superficial. It doesn't go through the carpal tunnel. Okay. So that's the one that you can see that pops out here. So again, that's going to be flexion of the wrist and a little bit at the elbow, but it's not a primary flexor of the elbow. And then here's flexor carpi ulnaris. We talked a little bit about that. Again, it's going to be at that common origin at the medial epicondyle, and that's going to be this one here. So it goes into the pisiform in the hamate.
What exactly is the carpal tunnel? Can you describe it?
Yeah. I can give. I have some other PowerPoint stuff that has more pictures of it. Maybe I can do that later. But basically, what it is if you're in this position here, the floor of it is the carpal bones. Okay, so a lot of people will think that it's here, but if you remember, where's your pisiform? It's right here. That's like the corner of your palm. And then you have the trapezium over here. And then you have the hook of the hamate right there. You have the scaphoid and then the trapezium here. So then on the roof of it, you have a ligament that goes across there. Okay, so then through that tunnel, you have all the tendons that go to the fingers. The ones like the flexor carpi ulnaris and flexor carpi radialis, they don't go through the carpal tunnel because they're stopping right here. But any of these tendons that go in through the palm into the fingers, except for the palmaris, are going to go through that carpal tunnel. Okay? And then there's also the median nerve. right here that goes through the carpal tunnel. So that's what happens when people get carpal tunnel syndrome. It's because the median nerve gets compressed, and then the sensory distribution of the median nerve is right here. Right? So a lot of times people will say, oh my God, I got carpal tunnel. And you ask, well, what's your symptoms? Well, I got pain in my forearm here and into my hand and my wrist. That's not really going to be carpal tunnel. For people that have carpal tunnel syndrome, it's going to be numbness and tingling in these first 3 fingers, and a lot of times weakness of grip. If you're not having numbness or tingling in this area here, if you have just generalized pain, a lot of times it's going to be tendonitis. Okay. All right, so we're talking about flexor carpi ulnaris. That's going to go to the pisiform in the hamate, and then also the base of the fifth metacarpal. So that motion, it would do wrist flexion, but then also it might do, this motion is called, when we talk about the motions in the hand, you have flexion and extension, and then you have radial deviation and ulnar deviation. Okay, so this flexor carpi ulnaris, which one would that be more likely to do? Radial deviation or ulnar deviation? Ulnar deviation. Like that. And then now if we're talking about muscles that go all the way into the fingers, then we're going to call this flexor digitorum, and then because there's 2 of them, one's going to be superficial and one's going to be deep. All right, so this flexor digitorum superficialis is going to come off of that common tendon again, and then it's going to insert into the phalanges, but it's going to be in the middle phalanges. So it's only going to do this motion right here. Okay. And then the profundus is going to do this one here. So it's a flexor, so it's going to flex the wrist, but now we're also talking about flexion of the fingers to this point here. And then now the thumb has its own special muscle. Okay, so then you're going to call these flexor, and then the middle name is going to be pollicus. So there's a few that are going to have the name pollicus. So now we're going to have flexor pollicus longus. So then now we're starting to get into the little bit deeper layer. So we're not talking about the common flexor origin here. So that's going to be this one here. So now we're coming off of the radius here. And then a little bit of the anterior surface of the ulna. And then again, if it crosses here, then it's going to go attach from that interosseous membrane. So you have the 2 bones of the forearm, and then you have a membrane that goes in between them. So it's going to attach to, some of it's going to attach onto the radius, then the interosseous membrane, and then also part of the ulna here. And then it's going to go into the distal phalanges of the thumb. So it's going to flex all the way like this. And then we have the flexor digitorum superficialis. Now we have the flexor digitorum profundus. So see, that's a little bit, it's not crossing an elbow now. Now we're talking about muscles that are only in the forearm. So here is the flexor digitorum profundus, and you can see that's going to go to the distal phalanges. So that's going to do this motion. Okay, so then together, the digitorum profundus, the flexor digitorum muscles are going to flex the fingers and the wrist. One of the superficial one is going to do this motion, and then the deep one is going to do this motion. So again, now we're talking about muscles that don't cross the elbow. They're not from that common flexor origin. They're going into the fingers and the thumbs. And then again, here's the pronator quadratus, so that's going to go on the anterior, the origins on the ulnar, and then the insertions on the radius. So it's going to pull across like that. So that's going to do the primary mover for pronation, and then it's also the pronator quadratus is going to help with that too.